I think we just had a great session on mantle cell lymphoma. Essentially talked about the heterogeneity in terms of biology and how that's helping us to determine personalized treatment based on the disease and also patient characteristics. Secondly, I think we talked about new treatment in the horizon, especially introduction of new agents, particularly in the initial therapy settings, that adding to the current chemoimmunotherapy or exploration of chemotherapy-free options. I think those are very, very interesting. Thirdly, we talked about for patients who may develop resistance and what kind of immunotherapeutic options there is. Example of that include CAR T cell therapy, for examples, antibodies that target novel surface molecules such as ROR1 antibody, and also newer agents such as bispecific antibody that brings together CD20 positive B cells and utilize the anti-tumor effect of CD3 T cells. And then finally, we talked about what's the emerging options for mantle cell lymphoma, and including combinations of treatment to combine with a agent called proton tyrosine kinase inhibitors, so BTK combinations, and that we hope could overcome resistance and provide therapy for patients who may come with high-risk disease. So I think the new development is really geared towards how can we treat patients with very high-risk conditions such as TP53 mutations, and they come in with very intrinsic high resistance to standard chemoimmunotherapy, but perhaps also to biological agents such as BTK inhibitors and others. So I think the challenges and unmet needs remains to be, coming up with a good combination that are effective, but also low toxicity, and one that can provide very durable responses, and also the importance of finding out some kind of algorithm for us to sequence treatment. So if one of the therapies become resistant, what would be the next appropriate options? I think that depending on their previous treatment, that also depending on the biological composition of the disease, or if they have developed any kind of new mutations.